Alright.
Hello, I'm Robert Bush. Our group today is going to be presenting the mid-range theory of chronic sorrow. It'll be Marshall Boyette, Orlise Bice, and Ben Coffey. I had a theorist background. Georgine Yates was born in North Carolina in 1945. She attended Watts Hospital School of Nursing, located in Carolina. She received a diploma in 1966. She later earned a bachelorette degree from North Carolina, Texas Technical State University in 1977, graduated with honors. 3 years later, in 1980, she completed a Master's of Science program at the University of North Carolina. She earned her doctorate degree in 1988. Due to her personal experience with life-threatening injuries in a car accident, she began to realize the lack of preparation that healthcare providers and general lay people had on the understanding of dealing with death and dying. And this is where her journey towards chronic sorrow began. Her collaboration partner was Mary Burke. It's Dr. Burke. She was born in 1941 in Ohio. In 1962, she got her diploma from the Good Samaritan Hospital of Nursing in Cincinnati, Ohio. Later that year, following years of working as a pediatric nurse, she graduated with honors from Rhode Island College in Providence with a baccalaureate in nursing. She graduated at Boston University in 1982 with her master's in parent-child nursing. 7 years later, she finished and completed her doctorate of science from Boston University. And Burke had always been fascinated with chronic sorrow. It was the time of her master's thesis when she was working with children with spina bifida, and when her passion for chronic sorrow really began. Margaret Hainsworth was born in 1931 in Ontario, Canada. In 1953, she earned a diploma from Buckville General Hospital. She later immigrated to the United States, and she went to Peabody College for teachers. She received a diploma in 1959. In 1973, she graduated with her BSN, and 1 year later, she achieved her master's in psychiatric and mental health nursing and got her doctorate degree from the University of Connecticut. She was a leader of a support group of women with multiple sclerosis, and during this time is when she became increasingly curious about the morbidity and correlation with sorrow. And this curiosity helped to develop her thesis work. And in 1989, they had a Sigma Theta Tau International Research Congress in Taiwan, and Dr. Burke was putting on a presentation, and Dr. Eakes and Dr. Hainsworth was also in attendance, and they ended up meeting with Dr. Burke, and they got together and they started talking about chronic sorrow and furthering their studies on it. They developed a modified Burke NCRCS chronic sorrow questionnaire. NCRS is a nursing consortium for research in chronic sorrow. Is what these 3 ladies developed. This established the aid to further develop their evolution of chronic sorrow. The theory of chronic sorrow uses 2 primary sources. The sources was from Olshansky back in 1962. He's the one that gets credit for the term chronic sorrow, and Lazarus and Folkman in 1984. Lazarus and Folkman provide their model of stress and adaptation to the form of the understanding of how persons experience chronic sorrows cope. And the term chronic sorrow is created by Olshansky after being observed by parents being mentally retarded children and seeing persistent sadness exhibited by these people. Burke's thesis work involving mothers and children diagnosed with spina bifida provided a foundation of empirical evidence that supported their first definition of chronic sorrow. Her work allowed to further describe chronic sorrow as a pervasive sadness that was permanent, period, and potentially progressive. Burke's thesis work encouraged further studies, helped develop guidelines for studies and conducting interviews related to the topic of chronic sorrow. And after several studies, including individuals with cancer, infertility, multiple sclerosis, Parkinson's disease, and caregivers of adult children, this is where they provided much support to their theory. Dr. Eakes, Burke, and Hainsworth published works that assisted in description and development of mid-range theory of chronic sorrow. However, the work that best describes and expands the theory is an article called Mid-Range Theory of Chronic Sorrow. This work allows the theorists to describe in depth their mid-range theory of chronic sorrow, define the theory's framework and its purpose. Eakes, Burke, and Hainsworth also publish Chronic Sorrow, the Life Experience of Bereaved Individuals.
Hi, my name is Marsha Boyette. I'm going to be talking about major considerations of the theory. The nursing paradigm and major assumptions include and define client and person as being each individual developing their own idealistic view of the world, life, and health. Each individual has an ideal perception of life processes and health. The environment is defined as the full of interactions that happen in the social context. And the social context consists of the family, the social, that work, health environment. Each person reacts according to their social norms. Other major considerations of the theory: health is defined as the normality of functioning. The health of the client depends upon adaptation of disparities associated with loss. Nursing is the nurse can diagnose and provide appropriate nursing interventions for the client experiencing chronic sorrow. The nurse can also help those at risk to prepare for anticipatory guidance. The primary roles of the nurse include empathetic presence, teacher, expert, and caring, and the competent caregiver. The other major considerations are chronic sorrow. According to Eakes, Burke, and Hainsworth, the defining characteristics of chronic sorrow include a perception of sadness or sorrow over time in a situation with no predictable end, sadness or sorrow that is cyclic or recurrent, sadness or sorrow that is triggered internally or externally and brings to mind a person's loss that's happened previously, or sadness or sorrow that is progressive and can intensify over time. Loss is defined as the event that must occur before the onset of chronic sorrow. Loss is experienced by everyone differently due to their view of the situation. Triggered events are sometimes referred to as milestones. These are things that happen. They include situations, circumstances, and conditions that may bring disparity. The events that will trigger confrontation with ongoing disparity will vary depending on the loss that is associated with chronic or life-threatening condition. Management methods are the coping skills that we use to adapt to chronic sorrow that our patients and caregivers experience. The management methods can be internal or external in nature. You have ineffective management, which come from strategies that will increase the discomfort or increase feelings of chronic sorrow. Your effective management are skills and strategies that lead to comfort in the individual. Major assumptions. The major assumptions of chronic sorrow are: humans experience loss and will have chronic sorrow. The person experiencing loss will compare their experiences with other experiences. The health and the environment will affect the person's coping strategies. Theatrical assertions and propositions. Healthcare professionals' interventions may or may not be effective in assisting the individual to regain normal equilibrium. A human who experiences a single or ongoing loss will perceive a disparity between ideal and reality. The disparity between the real and the ideal leads to feelings of pervasive sadness and grief. In summary, I have the chronic sorrow is a normal response to continuing disparity caused by a loss. Nurses and healthcare professionals need to recognize that loss is a normal life event. Individuals need to be assisted during their time of loss and during triggered events to help facilitate effective management. Although when chronic sorrow does occur, healthcare professionals need to help the client manage their loss and provide support during their time of it. Thank you.
Hi, my name's Ben, and I'm going to be talking about the concepts, relationships, and the schematic. If you look at the schematic, grief occurs throughout a person's lifespan. It's precipitated by two antecedents. The first antecedent is initiated when a single event of loss or is experienced, or when there is an onset diagnosis of a chronic illness. This leads to the second antecedent, which is unresolved disparity resulting from the loss. When a person is unable to deal with the loss, they develop a gap between reality and fantasy, and this creates an unresolved disparity. It manifests itself as sadness or other grief-related feelings associated with ongoing disparity resulting from a loss experience. Concepts and relationships are the adaptation of management methods. The Nursing Consortium for Research on Chronic Sorrow has broken down the management techniques into internal and external. For internal management, you have action, cognitive, interpersonal, and emotional. For example, examples of these techniques would be distraction methods, positive thinking, support groups, and just the basic expression of your emotions. External management methods are the use of healthcare practitioners to aid in the coping, i.e. professional counselors such as psychiatrists, psychologists, psychiatric nurse practitioners, pharmaceutical interventions, and spiritual support groups. When a person is ineffective in managing or coping their grief, the result is that the strategies that they're using or failing to use are increasing their discomfort. They also heighten the feelings of chronic sorrow. Ineffective coping methods result in a continued discomfort. Effective management or coping results from strategies that lead to increased comfort of the affected individual. Effective coping methods result in increased comfort. There are also triggers that may cause a re-experience of the initial grief feeling. In other words, a person might be feeling better, they might feel that they're getting over it, and then one of these triggers comes along and it throws them back into the grief process. The grief process is ensued, and management methods need to be utilized to prevent development of chronic sorrow. I can use an example of the nurse that I know or that I've worked with. She's been unable to deal with the death of her son, and because it was quite unexpected, he took his own life. And because of that, whenever there is a younger person that comes in for trauma, she's unable to go down there and deal with that situation. The theory of chronic sorrow is based on a series of qualitative studies. With the empirical evidence, NCRCS theorists described the phenomenon of chronic sorrow. They were able to identify common triggers of grief and describe internal coping mechanisms and the role of nurses in the external management of chronic sorrow. Thank you.
Hello, my name is Arlise Bias, and I will be discussing the theoretical model, implications of nursing practice, reviewing a case scenario related to chronic sorrow, and summarizing our project on chronic sorrow. The theoretical model. The work of the NCRCS provided a theoretical basis for several master theses and doctoral dissertations. 3 continuing educational articles use the consultorium's work in chronic sorrow. The major implications or suggestions for nurses and assisted individuals and family caregivers to effectively manage the milestones triggering events. Implications in nursing practice. In the scope of nursing, in the practice of nursing, it is in the scope of nursing to be able to identify signs and symptoms, triggers, and understand the interventions that need to be implemented. The advanced practice nurse assisting individuals experiencing chronic sorrow is resourceful in implementing effective management strategies, allowing those affected by chronic sorrow to deal with triggers. Management of triggers, such as comparison with norms and anniversaries, is facilitated by the advanced practice nurse's ability to perform in the roles pointed out by the NCRCS theories. When patients are evaluated as experiencing chronic sorrow, it is critical that the advanced practice nurse assist the patient in identifying internal and external management strategies. As previously stated, internal management uses action, cognitive, interpersonal, and emotional strategies to cope with pain and decrease recurring feelings of grief. Internal management strategies include positive thinking, talking to someone, and expressing emotions. Internal management is provided when the APN increases comfort through performing the roles of empathetic presence, teacher expert, and caring, and competent professional. Aches, Burke, and Hainsworth's chronic sorrow theory has been used in various client areas, such as patients with or families with cancer, multiple sclerosis, infertility, HIV, chronic mental disease, children with developmental delays, bereaved individuals, and Parkinson's disease. Now we'll review a case study that's related to a family experiencing chronic sorrow. Margot and her husband Greg, first-time parents, learned their son Jack had developmental delays related to cerebral palsy at 9 months old. Jack is currently 5 years old, unable to walk, nonverbal, has difficulty grasping small objects, and has been recently placed in the pediatric intensive care unit with a new onset of seizure activity. Due to Jack's recent illness and developmental delays, his mother has been unable to return to work, and his father is spending a large sum of their income on health insurance and medical expenses. Today, Jack and his parents are scheduled to visit their local pediatric clinic for a follow-up visit. At today's visit, Jack's parents deny any seizure activity since hospitalization and report that Jack is more alert and showing his usual signs of emotion. Upon assessment, both parents agreed to feeling overwhelmed by Jack's recent hospitalization and voiced further concerns about Jack's health and development. These assessment findings prompted implementation of the caregiver's chronic sorrow assessment based on NCRSC's theory. Margot reports recurrent episodes of grief in regard to her son's developmental delays, with increased feelings of sadness since Jack's recent diagnosis of seizure disorder. The advanced practice nurse asks Jack's mother what triggers feelings of chronic sorrow, and she reports feeling cheated since Jack is not able to communicate and function like a normal 5-year-old. In evaluation, Jack's parents were educated on chronic sorrow, assisted with identifying triggers, and referred to a vocal support group for parents of children with special needs. In summary, the middle range theory of chronic sorrow provides a framework for understanding the reactions of individuals to loss. Chronic sorrow can affect any person of any age, race, or social class. Recognition by healthcare professionals is important. Because chronic sorrow spans throughout lifetime, empathy from healthcare professionals is important and is recognized as the most effective form of support for people experiencing chronic sorrow. Thank you.